Our main goal during the design planning of our ICU modernization was to create a safe and healing patient-centered environment. Our second goal was to create a state-of-the-art, efficient intensive care unit that would allow our healthcare team to provide the best care possible for our most acutely ill population. We knew we had to involve our patients and families as well as the healthcare team members. Design planning included past patients and community members who make up our patient advisory board. When visitors arrive on the 6th floor, they're greeted by a volunteer team member. Adjacent to the entrance is the family and visitor waiting area. It's a large room with adequate seating and a calm and welcoming feel. Our families expressed the desire for private space, which inspired our pods of privacy within the waiting room. The Patient Advisory Council was instrumental in selecting the furnishings, which include high-back seating arrangements that create the individual pods. Each space has electric and USB device charging outlets. Several of the pieces convert to single beds for sleeping. In order to create flexibility within the space, we added mobile chairs and tables that can be added to areas for additional seating or stored out of the way. A kitchen area is provided with complimentary coffee and tea. Natural lighting, artwork with local nature scenes, neutral paint colors, and wood-like finishes complete the warm, calming feeling. Directly across the hallway is a separate private family consultation room available for difficult conversations. The ICU has a total of 22 rooms that are over 300 square feet. The overall room design was based around the most recent evidence that supports the use of 3 distinct zones: the staff zone, the patient zone, and the family zone, to optimize the healing environment. A family zone is located near the large picture window and allows the family to remain at the bedside and be actively involved in their loved one's care as part of their team. The large picture window provides natural light, promoting normal day-night cycles. Power window blinds allow for room darkening and light filtering if needed. A radiant heat panel is located directly above each bed. Each patient room has multiple lighting functions, including dimmable lights. The team lounge area also includes a large window for natural light, kitchen area, personal lockers, and a tech bar. Noise reduction measures were put in place by the use of decentralized nursing stations, monitoring and alarm management with mobile handheld devices, room supply stocking from the hallway, quiet closing glass entry doors, and sound-absorbing acoustic ceiling tile. Overall unit safety is provided by video monitoring surveillance at both entry doors. Visitors can request access by pressing a button which alerts staff members. Video and voice capability enables staff to determine the safety and grant access to the ICU with a click of a button. We first focused on hospital-acquired infections. Fabric privacy curtains were eliminated and replaced with glass doors that use electrochromatic technology to interchange between transparency and opaque state by applying power. Additional infection control measures include a well-demarcated safe zone using complementary floor colors. Medication errors were addressed by including personalized medication drawers within the nurse-server pass-through. Access to medications in the room adjacent to the medical record and dedicated medication preparation areas allow nurses to prepare medications at the bedside using barcode scanner technology. A bariatric ceiling-mounted lift is standard in every room. The lift can be used for patient transfers, positioning, or limb elevations, decreasing fall risk and patient and team member injuries. Fall risk prevention was further addressed with baseboard night lighting to the bathroom and folding handrails to provide support on both sides of the patient. Access to the head of the bed is critical in an ICU setting. A combination head wall and column design was designed by the team to facilitate this. The electronic door sign is integrated directly to the patient's electronic medical record. Isolation status, dietary restrictions, resuscitation status, fall risk, and allergies are automatically populated by the electronic medical record. The side of the sign has distinctive lighting options for easy visual management. Green lighting illuminates when a patient is admitted to the room. Red lighting illuminates when staff members are in the room providing care. When staff members are in the patient room, their photo also appears on the electronic sign and on the TV within the room. Decentralized nurse stations are strategically placed between rooms, allowing for a direct line of sight to the patient and monitoring equipment. The station is equipped with both mobile and stationary charting equipment, as well as a 32-inch monitor for viewing of cardiac and physiologic monitoring of all patients in the ICU. Easy access and connectivity to other critical areas within the hospital are facilitated by 2 elevators within the unit. One elevator provides direct access to and from the operating room, located one floor above. The second elevator provides direct access to the cardiac cath lab, emergency department, CT and MRI imaging, and the helipad. With the increase in room size came a much larger overall unit. Team communication within this large area became a top priority. To address this, we implemented the use of real-time location system and mobile devices for all ICU team members. At the beginning of each shift, each nurse and nurse assistant is assigned a mobile device. This device allows them access to the call bell system and the monitoring system, as well as to communicate with other staff members throughout the hospital. Staff have the ability to page a physician using these devices. They can call ancillary departments using a shared phone directory. They also have access to apps that provide reference material. Within the patient room, efficiencies were created within the design of the staff zone. Standardized nurse servers contain medical supplies, individual patient medications, personal protective equipment, and dirty linen cart. The patient zone encompasses the bed, medical gas outlets, which are supplied through a head wall panel and column combination, the nurse call system, and the interactive patient education entertainment system. Several support areas are located within the core of the unit. 2 centralized storage rooms have supplies for restocking nurse servers, specialized equipment, and patient nourishment areas. 2 centralized collaborative care centers provide an area for consulting physicians and support staff to discuss the care of patients, as well as both mobile and stationary workspace for dictation and documentation. The area includes a central printing station, video display of staff assignments and real-time location of staff, as well as a pneumatic tube system for connectivity to the laboratory and pharmacy. Within the unit is a designated respiratory therapy and blood gas laboratory. A corridor within the direct center of the unit provides quick access to the most critical equipment, including crash carts and intubation equipment. The interactive patient care system provides the opportunity to engage, educate, and empower patients and families. The system is accessed by the patient or family through the in-room 43-inch smart TV using a pillow speaker or a Bluetooth keyboard. Education features include videos for patient-specific medications, tests, and procedures. These videos can be ordered by clinical staff through the medical record or can be browsed directly through the TV. Before a video is viewed, a question is presented to identify who is viewing the material. After the video is completed, an additional question verifying comprehension is completed and automatically documented into the medical record. By applying the principles of lean to healthcare design, we have brought what adds value from the patient's perspective and eliminated what does not add value. This immediately improved flow in the ICU, relieved staff of unnecessary burden of wasteful work, and helped to optimize the patient experience.